I'm Leslie Elliott Boyce, and this is The Radical Center, a recording project I began in 2022 as a way to describe and discuss the social and ideological currents that are rapidly altering our culture. In a time when political polarization seems to be the norm, I'm seeking to understand rather than react. I'm grateful to all the thoughtful men and women who share their stories and insights with me in this conversation series. If you would like to contribute to this project financially, there are links in the description. Thank you, and thank you all for listening and being part of this exploration. Today I'm speaking with Dr. Jared Ross, and we've spoken once before on this channel. I will link to that previous conversation in the video description if anybody wants to check that out, because it gives more of your backstory and more context. And I think that that would be a great watch for anybody who wants to follow up on this video. But I'll start with just reading a brief bio so that people will know who you are, Jared. So Dr. Jared L. Ross is a board-certified physician with over 25 years of experience as a paramedic, firefighter, and educator. Jared is clinically active in emergency medicine, EMS, addiction medicine, and alternative psychiatry. Jared has presented at over 100 national and international conferences and is frequently interviewed for media commentary. Dr. Ross is the founder and president of EMSEC LLC, which provides medical education and consulting services. Jared advocates for individual rights, bodily autonomy, and ending antisemitism and racism inside and outside of medicine. And Jared, we spoke some time ago about your interest in infant circumcision and concerns around circumcision. And I'm really fascinated by this topic. I have sons. This is a topic that I've grappled with in my own parenting, but not really, I haven't really seen the broader medical perspective on this that you can share, and also the religious perspective. So I think that this is it's a really big topic that I think, because the decision is isolated to just this one moment in a person's life, doesn't get talked about as much as it could. I mean, for me, I've got sons that are 12 and 14, so I thought about this at that point. And then it would be easy for me to go the rest of my life not really thinking about this, but it actually is a really important subject. And so thank you for bringing this here and being willing to have a conversation about it.
Thanks so much for having me on. It's a pleasure to be back on your show. It's been, a couple years, and really awesome to be back on. And I think you're right. This is a topic that just doesn't get talked about. It's something that people are uncomfortable talking about. It's, talking about human genitalia, which we tend to self-censor about a little bit. And so I know your audience is all very, mature and adult, but we're going to get into some of the nitty-gritty, and I think some of this may be uncomfortable for people to hear. It's certainly not easy to talk about, even as a trained physician, but I think it's really important that we discuss this. The other side of this is the terminology, and I think it's really important that we avoid the terminology circumcision. I'll say it once now, but I think what that does is it normalizes the practice. It gives it a name that is acceptable, societally acceptable, and so I think we need to be more accurate and more descriptive in what this is. And we talk about female genital mutilation. This is male genital mutilation. This really is mutilation. And that can be a very evocative term for people. I'm happy to use the term cutting or genital cutting as well, which is maybe a little bit more neutral, but I'll try to stick to those terms as we chat, because I think it's important that we don't intentionally or unintentionally try to normalize this practice.
Yeah, I think that's a great point. And I think another phrase that comes to mind for me is cosmetic surgery.
This really is cosmetic, and that was one of the things I wanted to talk about, and I'm happy to jump to that. This is altering form purely for cosmetic reasons, right? And at the same time destroying function. And so when I talk about this, one of the arguments that I'll get back is, well, parents shouldn't be allowed to consent to any surgeries for their child. And I said, well, no, there's clearly surgeries that are necessary for life or limb or for well-being. And what if your kid has an appendicitis? Okay, well, then you shouldn't be able to consent to any elective surgery, any plastic surgery
Mhm.
for your child. And I think where you get into an issue there is that the plastic surgery is there to restore form and or function. Um, like such as repairing a cleft lip or a cleft palate.
Mhm.
Um, you know, and ear pinning is one that commonly comes up because that's controversial. That's not functional, but it's form, but you're restoring form to a normative form. And I think that's into an ethical gray area. I mean, I think even to think about leaving a child, I mean, we have teams of doctors that go volunteer overseas in developing nations to fix cleft lip and palate because we have such good treatments for these, and these kids do so much better. I mean, not just nutritionally, but their ability to speak and just integrate into society is so much improved. It really has a major impact in their quality of life. And so this is really cosmetic surgery, and it's not just cosmetic surgery it's not restoring form. It's actually altering form, and it's doing so at the cost of function. And I think that's what's not talked about a lot is the very important function of the foreskin. But before we get into any of those arguments, before we get into the sexual harms, before we get into the pain that this causes little boys, before we get into the financial conflicts of interest, I think that the really big issue here is that this is a crystal clear ethical violation. It's as we said, it's cosmetic surgery without consent. And we allow parents to consent for their children when they're functioning in their children's best interests, under the assumption that they're acting in their children's best interest. But there's clearly no benefits to this. There's clearly harms to this. This is purely cosmetic. And so the fact that we're doing this is a clear violation of autonomy, bodily autonomy, which is one of the four pillars of medical ethics. And the fact that physicians are participating in this is very concerning as well, and is a
Mhm.
clear violation of their ethical duties as well.
Well, how do physicians make sense of that question of ethics? I mean, I've heard arguments for hygiene, and I know that there are lots of different arguments, but setting aside all of the cultural or religious arguments for just a moment, when you're talking about function and health, there are arguments that it is healthier. And I'm not saying that I agree with them. I'm just putting that out there because I imagine that must be something that a medical professional is considering when they're offering this service or offering this surgery to a family.
Yeah, I think unfortunately doctors are very poorly educated on this issue, poorly educated on the function of the foreskin, and this has become so deeply ingrained in our US medical system that it's just normative behavior. No one even thinks twice about it. There are numerous. I mean, I was just looking this up yesterday. There's numerous lawsuits of boys that have been cut by doctors um, in the hospital against their mother's wishes. Their
Oh my
mothers
gosh.
clearly said, "I don't want, I don't want this to happen," and and they just go ahead and do it anyways. It's like an assembly line process. Um, and there's stories out there from mothers who have chosen to keep their sons intact, who have faced pressure from their pediatricians, from their OBGYN doctors. And I think even more harmful than that is the labor and delivery nurses. A lot of the nurses come in and repeatedly push for this. Um, and so there's a lot of really, I guess, heartwarming stories of mothers pushing back. I can't imagine, and I know you said you have two boys. I can't imagine what it's like to be in the hospital after giving labor, after being in labor and giving birth. And I mean, all the surge of adrenaline and hormones and sleep deprivation and epidural and maybe medications, and the rush of emotions. But you're in such a discombobulated to to have someone who's an authority figure coming to you multiple times trying to get you to sign this paper to consent to this procedure. It's just completely medically unnecessary, right? And can be done at any time, right?
Mhm.
Any man, boy or man, can choose to go have his foreskin removed at any time in his life. And
Mhm.
and there's the argument against this is, oh, it's more painful, it's more complicated. It's like, you know what? I mean, the issue is that we don't acknowledge the pain of these infants. Infants cry, right? Infants don't have the ability to communicate verbally. And so we neglect that pain. And there's a lot of research, and I'm not very well versed on it. There's a lot of research looking at the pain that boys suffer through these procedures. One of the things that's important to keep in mind is that until puberty, really, the foreskin is attached to the glans penis.
Mhm.
So the foreskin will not retract until puberty. And so what you have to do to to perform to remove the foreskin is to first lyse those adhesions. So you have to go in there and cut between the foreskin and the glans penis to allow the foreskin to retract. And then you put this, barbaric clamp. There's a few different methods for this, and there's, these babies are being strapped down into into these trays. Their arms are tied down, their legs are tied down, spread eagle onto these trays. And this, so you lyse these adhesions, you put this clamp on, and then you cut the foreskin off. And so it's just an awful and barbaric procedure that's just completely medically unnecessary. But it's so, as you talked about, how do doctors wrap their head around this? And I think the issue is that doctors don't. This is just so ingrained and just such a normalized practice, really, in the U.S. I mean, you don't see rates of this practice in Western Europe at all. Canada's got lower rates than we do here in the U.S. Um, and so why is that? I mean, there's clearly financial conflicts of interest, and I think that's something that often gets neglected. Our OBGYNs and our pediatricians, especially, pediatricians are one of the lowest paid medical specialties. And, um, and that's unfortunate. Our primary care specialties are critical to preventative care and to health maintenance. And they do a lot of work for our community. they're not generally proceduralists. They're having long, difficult conversations with patients. They're following up on things. They're making sure that things happen. They're encouraging safe practices at home. They're modifying risk. But our medical system, our medical billing is based on procedural billing, and so they're not proceduralists, and they're not fairly compensated for their time. And this is a procedure that is very well compensated.
Mm.
And what's fascinating is that most, at least last I checked, most state Medicaid, that's your health insurance for indigent patients, for poor patients, will cover 100% of your pregnancy, of your labor and delivery costs, from your prenatal care, your prenatal vitamins, your prenatal visits, all your ultrasounds, admission to the hospital, delivery, newborn nursery, um, you know, and then all the visits there, the 1 day visit and the 3 day visit, all of that. Um, but they will not cover male genital cutting because they believe that that is cosmetic. And unfortunately, we've seen a shift where started covering this, and it's very unfortunate.
Mm.
But what shocks me is, having worked at a lot of inner city hospitals with very impoverished patients who don't have money, who haven't spent a penny. I mean, we're not talking copays that you and I might see on our private insurance. We're talking, 100% coverage with no co-insurance, no copay, who haven't spent a penny on this child, on this pregnancy, are happy to shell out hundreds, if not thousands of dollars to have this done. Um, and and so it's profitable. And again, I don't think that physicians are in there thinking, oh, let me do these in today but it just becomes ingrained. It
Mhm.
becomes part of this process. And its roots are religious, right? As a Jew, I can speak to the Jewish roots of it. It's the covenant, it's the sign of the covenant, and nothing is more, can you imagine going back to ancient days, right? How am I going to show my allegiance? How am I going to, as the head of a household, as the man, or even as the mother, how do I show my complete and total allegiance to my faith, to my tribe? Um, my family lineage is dependent, even though Judaism is matrilineal, right? There's still a huge importance on lineage passed through the sons, through the fathers. So I'm going to let the Moyle, who was a rabbi, or is a rabbi who's trained in this procedure, usually not a doctor, take my 8-day-old boy and cut off part of his penis. I mean, and we're talking a penis that's this big, right? And that one wrong move, and my lineage, my family's continuation is at risk. So it was a huge sign of trust. And 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 I think there's a lot of Jews that see this as an important covenant, a covenant with God, a covenant with Abraham. But there's a lot of things that we've changed as we've enlightened as humans, and realized that this is not appropriate. And again, if you, as an adult male, or a teenage male of competent age, decide that this is what you want to do, far be it from me to stop you from that. I think there's some serious questionable ethical issues if a physician's doing that, because as a physician, we have the Hippocratic Oath. We are obliged to do no harm, and this is cosmetic body modification.
Mhm. Mhm.
I mean, I guess you could make the same argument about elective breast augmentations for women, right? Is that I guess the plastic surgeons will say, oh, it's helping their self-esteem, and we can sit here all day and argue that. But at the end of the day, I don't think that's the real issue. I think the real issue is, why are we doing this on infant boys?
Mhm.
And so, I explained why this started in Judaism. It started in the Muslim faith as well, and I'm not an expert on that. But this has become ingrained in the American medical system as the American ideal of what a penis should look like.
Mhm.
Um, and if you look back on the history of the medicalization of this procedure, taking it out of the religious realm, where it was not done by a doctor, it was done by a rabbi or another specially trained layperson, and you look at the medicalization, what this really comes down to was the Puritans. This was a puritanical practice, and the idea behind it was to decrease masturbation
Mm.
of by boys. And there's no evidence whatsoever that it does that.
Mhm.
And children of both sexes masturbate, and that's a normal part of development and a normal part of human exploration. And I think it's important for parents to, make sure that that's done in a healthy and private setting, and not
Mhm.
not in a grotesque or public way. But there's no evidence whatsoever that this in any way alters masturbation behaviors. And then I think most concerning is not so much the physicians, but the financial incentives on the secondary market,
Mhm.
right? That foreskin tissue is incredibly valuable and is almost always sold.
Wow.
So it is a commodity. And just like the scandal that Planned Parenthood had with fetal tissue being sold, this is tissue that is rich in pluripotent stem cells, in cells that have a potential to develop many different ways, has very long telomeres and the ability to divide and increase in size, right? This is in infant tissue. So this is human infant tissue. And so this tissue is very valuable, and there's a large industry that buys up and processes foreskins, and those are used for some very noble purposes. I mean, they're used as skin grafts for patients who have suffered burns or severe infectious processes that need skin coverage. But the profit motives behind those companies, the markups that they make, harvesting these foreskins. I'll say harvesting because that's really what it is. Harvesting these foreskins off of boys and processing them and selling them back to the medical system is really scandalous,
Mhm.
and I think needs to be discussed further.
Yeah, you've brought up so many important points, and I think I would love to have, if you maybe someday want to do it, a whole conversation about medical ethics and the way that parents feel pressured to intervene with their kids. But this one, just staying on topic and not getting too far afield. Um, I was not that long ago with a young mother. I accompanied a young mother to a specialist visit because she had kept her son intact, and she was worried that this is somebody very close to me. So I was the person she reached out to, but her son was having a problem, a little bit of phimosis. So there was a swelling, a difficulty with urination, ballooning. If these things need to be explained, I'm sure you can be the one to do it, but most people will probably be familiar with some of that. So it was just a problem that an infant was having with his urinary tract and his penis. So she was taking him to a specialist, and she was really worried that she would be pushed into an intervention that she didn't want to do. She wanted to make sure that surgery was a really last resort. And so that pressure was really real, and she felt it, and it was one of the first things that was suggested. And I think it was helpful just having an older mother present who had this wasn't my first time interfacing with doctors, and I also used to work in the medical field. So I think it was helpful having somebody there to help her advocate, because she was feeling pushed to do a more dramatic intervention. And I just wanted to share that in light of what you were saying about parents feeling pressured. And but you've brought up so many interesting points. I think of the Sandra Bullock clip about her skin. This is a really famous one. Probably a lot of people have seen this. I don't know if she was talking with Oprah or somebody like that. And she's saying how beautiful her skin is. And Sandra Bullock says, well, it's foreskins. It's a cream that's made from infant foreskins. And she makes a joke about, it's just baby penises. And it's funny and people laugh, but there's something really macabre underneath of that. There's something, and as you're describing the financial part of this, which is something that I had not really ever thought about in this particular context. This is a procedure that's that's incentivized due to the big billing, that the big procedure billing that the providers can do in order to get compensation for this little quick procedure, and they can get quite a hefty payday from it. And then the hospital or somebody is turning around and also making bank on the product of that procedure, which is the skin that's been removed. And it just seems incredibly shady. Like you're basically making me pay you to give you part of myself that you're then going to sell anyway and make a lot of money on. And that whole thing, it just feels like, from a bioethics perspective, it's really concerning.
Very concerning. And I haven't read any of these consent forms recently. I'm sure it's buried in the consent form. But, I don't think any mother actually realizes that. I don't think it's verbalized. I don't think it's talked about. And again, you're signing this consent form in a really in a state of clouded judgment. I don't know that the mother has the capacity to sign the consent form in a lot of these situations, right? You're very sleep deprived. You've just gone through huge hormonal changes, huge emotional changes. And the fact of it is there's no urgency here. There's absolutely no urgency. If your child came out and has, a condition called bladder exstrophy, where their bladder is on the outside of their abdomen, or has a severe congenital heart defect that, both of these were, excellent in detecting in prenatal ultrasound. But, if for some reason God forbid, have a child that has a medical emergency that's detected at birth, and you have to say, hey, we got to get a consent for this and go address this now. I mean, that's one thing. There's an urgency there. There's a threat to life or a threat to function. But this is absolutely it doesn't need to be done, period. And so to imply that somehow it needs to be done urgently, or this decision needs to be made, it really is the boy's decision. Mm-hmm. And so I thank you for being there for her. I mean, I don't know that we'll have time to get into it today, But there's a whole nother side of this of mothers taking their intact sons in for medical care, not just as infants, but as they go through childhood, and this, the negative reaction from doctors of why didn't you, cut your boys, or whether or not they're having complications. There's groups out there that really try to educate doctors on the forcible retraction of the foreskin. As I mentioned, the foreskin is adhered to the glans penis until puberty, and so it should never be forcibly retracted. When and the boy will never do that because it's too painful. He'll retract it as necessary. Phimosis is rare, and there's plenty of ways to treat it. It's not an emergency. And humans have been managing with this for, if you include Homo erectus, 6 to 7 million years. Not an issue here. So we've, really stigmatized preserving form and function, and any issue that we have then becomes the mother often, or the father, or even the child, I've heard, becomes blamed for being this outlier, when in fact our medical system and our society as a whole, I'm sure we can talk about the normalization of the cut male penis through pornography. I know you've talked a lot about pornography on your channel, and how that impacts us. And I don't think, normalizing a certain, it's harmful to women as well, right? We see women who choose to undergo cosmetic surgery on their genitals, because of what they see in pornography, and because of what becomes normalized. The range of normal female genitalia, external female genitalia, is incredibly broad, incredibly broad. But what we've done with this is normalized a certain body modification of the male genitals. And I think we can look at, the African tribes that put the necklaces on the women. I don't know if they do it for the men, and stretch their neck out, or what are they called? The big barb piercings that people use to stretch their earlobes out. This is extreme body modification. And again, if you as an adult want to pursue that, just like getting your arm tattooed, have at it. That's your bodily autonomy. But we really need to see this stop with children. That's really where I'm concerned.
Yeah, again, I think you're just bringing up so many good points. And I think it's relevant to sort of go back to my own thought process about this when I was younger. The first time that I was introduced to the idea of circumcision or male genital cosmetic modification was when I was really young. My brothers came home from the hospital, and I remember my mom changing the baby's diaper, and there was a little ring around, just to speak really plainly here, because we're talking about a medical procedure, a ring around.
Yeah, no, I think it's really important.
Yeah, under the glands, I guess. And I would have been like little, like 6. And I remember asking, what is that? And it was a protection because he had an owie or something. That was kind of what my mom said. But it just looked kind of shockingly painful to me, like this bright red, like it shouldn't look like that. I didn't know what I was even supposed to be expecting things to look like, but it didn't look good. And I remember thinking that his little penis is going to be in a diaper with urine, and he's going to be the moisture and just the chafing. It just seemed like, from my very first experience with this, I thought, that poor kid, like the poor baby. And that was kind of as far as I got with that then. And then it was much later. I had my first daughter really young. I was 19, and she was a girl. So this was a topic that got raised and dismissed when I was speaking with her father, and we were talking about what, all the things parents talk about when they're about to have a baby. And circumcision came up, and I've heard this from other women too, because I later worked in a medical clinic that saw a lot of pediatrics and did maternity care as well. So this issue was a one that came up a lot, and I'd hear how people sort of process the dilemma over this cultural issue, this physical thing that's going to happen or not happen. And I remember kind of this deference to the father in myself, and I've seen it over and over in women too. Like, well, this isn't my domain as a woman. I don't have one of these, and it's you're the man, you're the dad. Why don't you make the choice? And there's often a sort of there's an amnesia. Of course, this happened to him before he could remember. And so it's like it was no big deal, and I want my son to look like me kind of decision that's often made. Or if the mother gets involved in it, it's sort of, I don't want him to be made fun of. I don't want him to look different than the other boys when he's older. So maybe we should just do this because it's a cultural norm. But those are some of the ways that I've heard people come across that issue. When later on, I had my sons, when I knew I was pregnant with a boy, had a similar discussion with his dad. And as we got into the subject, we went from kind of neutral on it, like, I don't know, what do you think? Is this seems kind of painful, and I'm not sure it's necessary, but are there good reasons for it? As we discussed it more, we both kind of shifted to a more decisive standpoint of absolutely not. Me, because I didn't want my son to be hurt, and I felt like this was going to risk attachment with us, just bringing such a sharp and severe pain into his first moments in the world. But I was really kind of focused on that immediate issue of the surgery and what that would be like for him. And then his dad was, the more he thought about it and read about it, he actually became really upset that this had been done to him. I mean, there was like a reckoning with this was done to me, and what did this take from me, and how did this change me? And I think that it's easy to sort of dismiss that because there are so many men in this, what is it right now? Probably the majority of American men, I think, have been circumcised. I know the trend is going the other way in the younger generation, but for adult men right now, probably the majority have had a circumcision. And I think it's easy to sort of just dismiss it because you're walking around, you're doing just fine. You're married, you're functioning, you have children, whatever it is. But it is profoundly changing to the body. And I wonder if you'd be able to speak to some of the ways that it actually changes in the long term. The boy's experience of his body, the man's experience of his body.
Yeah, I think that, I thank you for bringing those up. I think the lack of reluctance to think about this, that it is really this generational thing of, oh, it was done to me, I should do it to my sons. And, it does often get left to the father, right? I mean, that's really generational harm. We should really look at that the same way as we look at, domestic violence of, I was beaten as a child, so I should beat my children. I mean, that's not acceptable. That doesn't pass a sniff test. But in fact, that is a very common reason that's given, is that men don't really think twice about this. And then I think it's, fascinating that your partner, went through this and said, whoa, what was done to me? Like, what did I lose? Is there something that, that I need to critically examine here? And I think that's where this where this really needs to be talked about. And as you mentioned, seeing the blood on your brother, I mean, this is really a barbaric practice. This does not look anything like what modern day medical procedures or surgeries look like. And I really implore your viewers to go on YouTube and go Google. There's plenty of videos out there. I mean, this looks really awful. You don't have to be a doctor or have any medical experience to look at this and be like, this just doesn't feel right. Um, and so talking about feelings, I guess a good segue going from emotional feeling to physical feeling, is that there are clearly physical and sexual harms from removing the foreskin. The foreskin is not just an extra piece of tissue. It has critical function. And so one of them is preventing the keratinization, or the outer epithelialization of the glans penis. Just like the skin on the outside of my cheek is very different from the buccal mucosa on the inside of my cheek. Part of the glans penis is very much like the inside of my cheek, like the buccal mucosa. And in order for it to stay moist and to stay protected, and we talked about chafing before with your brother, but in order to prevent chafing, not just as an infant but throughout life, the foreskin serves an important purpose to protect the most sensitive part of the male anatomy. Right. And I love talking about the analogies, the embryology, comparing male genital mutilation to female genital mutilation, because, everyone, you talk about female genital mutilation, everyone is equally agrees that this is, a crime against humanity, that this is a clear ethical violation, is completely wrong. But no one goes to the level and says, well, what's the embryological comparison? What's the the glans penis is the same as the clitoris embryologically, and the foreskin is the same as the hood of the clitoris. And so, yes, there are adult women who choose to have part or all of their clitoral hood removed for various sexual purposes or cosmetic purposes. But again, those are adult women who have the right to do what they want with their body. But and the WHO actually has classifications for female genital mutilation. And WHO classification 1A is complete or partial removal of the clitoral hood. That's the same thing that is being done tens of thousands of times in hospitals across our nation on boys every single day without a second thought given to it. In fact, it's very profitable for both the doctors and for the hospitals. If you do this if you remove the same embryological tissue from a female in this country, that's a felony. That's a minimum of 10 years in prison. Wow. And so the disconnect here is just, and people will say, oh, most types of female genital mutilation are worse, or start removing the clitoris, or removing the labia, or doing something called infundibulation, sewing together the vaginal tissue. And I said, agree, those are all terrible, but it's all terrible. It all needs to stop. And so just like the clitoral hood provides protection, retains sensitivity, keeps moisture present, and prevents the keratinization, prevents the development of an epithelial layer, of a skin layer on the glands, the foreskin does the same thing. So it has a very important protective function. It has a very important sexual function, which I think we again, we self-censor and we don't want to talk about. But the foreskin glides over the glans penis. And so during sexual intercourse, that's an important part of the biomechanics of sexual intercourse, is that there's a gliding action to reduce friction. If you remove that tissue, you are, solely dependent on lubrication from the female or from, external lubricants for sexual intercourse. This is how humans evolved. And it's not just how humans evolved. I mean, this is how mammals evolved. I mean, your dog has a foreskin, your horse has a foreskin, and no one removes these, right? We regularly castrate dogs and cats in this country, and I think animals are not humans, and there's different ethical standards that apply, and we can talk about this all day. But no one says, while we're removing your dog's testicles, maybe we should, cut the foreskin off as well. It's just, it's just mind-boggling, and to think, I mean, humans hopefully aren't rolling around in the mud, but you look at dogs and other mammals that are rolling around in the mud. This has a really important, protective. It has an important sexual function, preventing chafing and this gliding action of sexual intercourse. And then I think what gets severely, severely neglected is the nerve endings, is that the foreskin has a lot of sensitivity, and it has a lot of a specific type of nerve ending called a C delta fiber. So if you run your hand against the palm of your other hand versus run it against the back of your hand on the other hand. When you run it against the back of your hand, you kind of have this sensation that kind of makes the hair on the back of your neck stand. And what that is that's the C delta fibers. And those C delta fibers are only present in certain parts of our body, and they're pressure sensitive nerve fibers. And nerve fibers don't regenerate. So once you cut off those 15,000 nerve endings, those are gone. And so when we talk about the sexual harms, we talk about the protective aspect, we talk about the functional aspect with sexual intercourse, and then we talk about the sensation and sensory aspect. And again, we don't even have to get into the weeds of the sexual issues, of the comparison to female genital mutilation, the pain, the financial conflicts of interest. I try not to get into that with people. What I try to say to people is this is just such a crystal clear ethical violation to perform purely cosmetic surgery on an infant because he's a man, and to send people to prison who do the exact same thing to a female. It is just a huge contradiction. And again, when you're an adult, far be it from me to argue with you. I think tattoos are very tasteless. But that doesn't stop anyone from going out there and getting tattoos.
Well, I think, you've shared a lot about the form and the physical experience. And I think something I wonder about is the psychological impact of this. Like, you take a human being who's just been born, and everything that they need is safety, security, comfort, nourishment, and you pin them down and subject them to an incredibly, shockingly painful surgery. And I don't know how much they use painkillers at this point. I know that's a question. Sometimes it's been not used. I know there's an issue around chemical introduction to the baby's body. What is better, to let him go through this pain that he's not ever going to remember, or to give him a dose of chemicals. Either way, you've done something that is going to alter his body and his experience of bonding and attachment in his first moments. But then not only did he go through a physical a surgery that was immediately painful, but he's also recovering from a surgery in his first days. His young body is experiencing ongoing pain that he has to recover from. And I wonder how that impacts the attachment between a little boy and his family, and how that might impact his ongoing ability to trust and attach. I can imagine that that's not negligible, that there's something in that. But then also when you talk about sexual functioning later in life, once a person is sexually mature, if your body doesn't work the way it's supposed to, and you have this keratinizing of really sensitive tissue that was meant to feel a certain way and now it feels another way, and this impacts the experience that you have of physical bonding with your mate, the most important and most intimate act that you share in this particular relationship. How does the changed form and changed function of your body impact your ability to properly bond with your mate through that most intimate act? And I don't know if you have studies or answers to these things, if there's been work done on, but I can only imagine that it's not an insignificant thing.
Wow. I mean, Leslie, you bring up so many great points here. I think you know, something I didn't even think about is you're taking a baby boy and he's spending his first formative days on this earth recovering from a procedure. And yeah, if he was born with a congenital heart defect and this was necessary for his survival, I still think that would be traumatic, but we would agree that the alternative is his demise. That's just not the situation here. And to take your new baby home and for them to be recovering from this unnecessary surgery is, I think, is really catastrophic. And I mean, I know your expertise is in the mental health side. I certainly get into some of those issues, but I think there's a great deal of emotional trauma and a great deal of grieving and loss that men and boys who come to terms with this, who realize, who question this, right? Because I think it's not just the medical system, but it's society as a whole has kind of agreed that we take this for granted, that we don't question it, don't question the dominant mantra. And so maybe that is somewhat of a defense mechanism, that if we don't get into this, if we don't think about our loss, if we don't acknowledge our loss, we can't grieve something that we haven't acknowledged. And so it's like the first step of 12 step. You've got to acknowledge that there's a problem before you can address it. If you don't acknowledge there's a problem, you don't have to address it. I will talk about the anesthesia side. You mentioned that. By and large, this is done with two types of anesthesia. Usually a topical numbing cream is applied to the boy's penis, which is, completely and utterly insufficient. And that's not what's done when adults or adolescent boys choose to undergo this procedure. And even with some of these creams, they can work very well for certain procedures. We use similar creams in the emergency department to, for instance, sew up head lacerations. If a kid cuts their head, we can put this on instead of getting in there with a needle and traumatizing a kid, injecting medication that might burn as well. We can put this cream on, and it's open skin as well, so it kind of soaks in better. But you got to wait a good 30 minutes for that to soak in. Again, these are churned out so quickly that even if these creams were to be effective or were to be, they need to be on the penis for some significant time, and I just don't think that's being done. The other thing is sucrose, sugar water is given. They give the baby some drops of sugar water to, what is this, like a popsicle
Hmm.
at the
It's a
dentist's office? I mean,
distraction.
it's just
Yeah.
it is. It really it's really just absolutely inexcusable.
Hmm.
And that's why it's not, when this is done on adult males and adolescents, it's not done like this. And then the proponents will say, well, yeah, it becomes a big deal to have he has to have anesthesia. We should, it's like,
Hmm.
no, we should have, um, that's not a reason to do things
Hmm.
inappropriately.
Hmm. Hmm. Yeah, it's so interesting. And I know I'm tempted to go into other areas with this because for instance, one of the clinics that I worked for, the doctor who was also the owner of the clinic trained in doing frenotomy or frenectomy, which is the tongue tie release. And I felt like, this is my opinion, I felt like it was being overused. I felt like tongue tie was being overdiagnosed because this became a very lucrative thing. And I, in my work there, I assisted in this procedure often, and it really killed me that the pain relief was sugar. It was the sucrose you're talking about. It was a little dropper of sugar water in order to kind of make them go, whoa, what is that? And get them kind of distracted. So then the doctor could go in and slice this tissue. And oh, just I that is a whole rabbit hole that I'm tempted to explore with you, but in the interest of time, and since it's a little bit off topic, I'll leave it there. And if we want to pick it back up at some point, we can. But one thing I wanted to ask you about, and you touched on this earlier, I know that your Judaism is important to you, very important part of your life and your identity. And I know this from previous conversations we've had and from what you just mentioned there. And I also know that this must be a very controversial position to take a within a religion that has completely normalized and accepted that this is the thing that we do with our sons. So I wonder what that's like. For what kind of responses do you get from other Jews, other Jewish doctors, and how does that conversation look within that context?
Yeah, thank you for the question. I mean, it's a really tough conversation to have as someone who's, very active in my faith and very much practicing.
Mhm.
And it's a very, very challenging topic. And many people in the Jewish community aren't even willing to indulge it.
Mm.
Um, and I think this ends up being, one of the things I wanted to talk about was the attempted justifications for male genital cutting, and one of the, often given is the religious purposes, and then, people who fight against it are called anti-Semitic, and
Mhm.
um, but first of all, most of this is being done in the hospital. It's being done, in the first few days after birth, before the boy goes home
Mhm.
with his mother. So Jewish law says that a bris has to be done at 8 days of age. In fact, it is so important that it's done on the eighth day of life that it is the only Jewish ceremony that is allowed to occur on the Sabbath, on the holy day
Oh,
of rest
wow.
between Friday night and Saturday night. And it's even allowed to occur on the one day of the year of mourning and atonement, the most solemn day of the year, on Yom Kippur, when people are not supposed to bathe, where you're supposed to, wear dark colors, you fast for the entire day. It is an entire day of atonement. There's no celebration that
Mhm.
day. If a boy is born 8 days before Yom Kippur, there will be a
Mhm.
bris, and it will happen on Yom Kippur. Even funerals in the Jewish tradition are delayed. There's a time limit from when a Jewish person dies until they have to be put in the ground.
Mhm.
There's There's two exceptions to that. One is the Sabbath, is that the time during the Sabbath doesn't count, and the other is Yom Kippur, is the day of mourning and atonement, or atonement really. It's not so much mourning. Um, but a Brit doesn't get that. It still happens. So anyone that's saying that, oh, it's an important part of Judaism, BS. That is absolute BS. If you are religious and you say, and this is an issue in some of the Orthodox communities, you go into a hospital, you say, no, I don't want my baby boy cut because I'm taking him to the moil, to the Jewish rabbi who's not a doctor usually. There's some moils out there who are physicians, but I'm taking him on the 8th day for this. That is for religious purposes. I will still argue wholeheartedly that this is a huge ethical issue. Mm-hmm. And there's great alternatives to it. There's a wonderful book out there called Brit Shalom, welcoming the boy into the world, mm-hmm. As the covenant. There's a practice called Brit Adam, which is done for men who convert to Judaism who have already been cut as a child. Mm-hmm. So if in an Orthodox conversion, if a man wishes to convert to Judaism and he has not been cut, he is required to be cut, which I think is awful. But if he is already cut, what do we do as an acceptable alternative? We take a needle and poke what's left of the foreskin for a drop of blood. Mm. And that's the covenant of blood.
Okay.
And so I'm a big advocate of if this is important to you, and it's important to me, and if I have a son one day, and I hope to, I happen to have multiple sons and multiple children, that this is what I'll do for my kids. I mean, is it inflicting pain? Yeah, it's a minimal amount of pain. We give children vaccines, quick needle pokes, right? This is not barbaric devices. This is taking the same lancet that a person with diabetes uses on their finger 4 to 6 times a day and poking the skin, and you get a drop of blood and you call it a day. And there's no harm being done. There's no sexual harm. Yeah, is there a momentary pain? Yeah. But you've fulfilled the covenant of blood. This is good enough for Orthodox and ultra-Orthodox conversions for men who have already been cut as a child. And so there's no reason that can't be acceptable. And but still, surprisingly, I get a lot of pushback from Jewish physicians as well. Mm-hmm. I mean, that can be the hardest group to argue with, which would surprise you. You would think that maybe as a Jew you've been, I don't want to say indoctrinated, but you've learned to take this for granted. But as we talked about earlier, the medical community has learned to take this for granted and become indoctrinated that this is so normalized. And so what you have is that instead of someone who's able to kind of critically think and try to balance their faith and their medical ethics, instead they've been indoctrinated as a Jew and they've been indoctrinated as a physician, mm-hmm. and they just are so dead set on this. Mm-hmm. And this is where those other, and I mean, if you allow me to go into some of the other justifications,
please.
I'd love to. I mean, one of them is the hygiene, right? You mentioned this idea that boys can't keep their foreskin clean, and so we should cut it off. And I mean, that's just absolutely absurd. I mean, by that logic, we should maybe we should just pull all teeth out of kids because they can't brush their teeth. I mean, we don't amputate body parts for the purpose of hygiene. Mm-hmm. encourage hygiene, we improve hygiene. I mean, so that's just absolutely ridiculous. And then we get into the, complication and infection, right? You were talking about phimosis, which is a problem, which, what I mean, less than 1% of boys, again, mostly treated non-surgically, not a big deal.
Hmm.
I mean, so we don't have to think about this. And there's paraphimosis, which is a more serious condition where the foreskin retracts, not in boys, usually after puberty or in men, where the foreskin retracts and traps the glands,
Mm.
and the foreskin can't be unretracted to cover the glands. And that's a real emergency. I've had to deal with that as an emergency doctor, because the glands, penis, again, the most sensitive part of the male genitalia, is losing blood flow.
Eesh.
And so that does become an
Sounds
emergency.
painful. Yeah.
It's very painful, right? We have ways to deal with that. We use,
Mhm.
we can compression wrap it.
Mhm.
Actually, as a last resort, is to cut a slit
Mhm.
in the foreskin so that you can bring it back over.
Mhm.
But again, if we're to do this, to do things to reduce the risk of infection, and this is not to say that there's, we're not even talking about the complications from infant male genital
Mhm.
cutting, the infection issues, the bleeding issues. I mean, you find out that a kid's got hemophilia because he won't stop bleeding
Oh.
after you've cut this. I mean, so we talk about hygiene and infection. Urinary tract infections is a big thing, right? Men
Mm.
men who are cut have almost no urinary tract infections until they get into their 60s or so, when they start having prostate issues, and to say, oh well, we should do this so we don't have urinary tract infections. It's like, come on, we have antibiotics. If he develops a urinary tract infection, we can treat that with antibiotics. It's not a certain that he'll develop it.
Mhm.
Um, and and by that logic, I mean, we know that women who have undergone female genital mutilation have lower rates of urinary tract infections as well. So I mean, let's go down that road.
Mhm.
And then the last thing they pull up is, of course, the HIV/AIDS stuff, because because we don't have a cure for that, because that's not easily treatable. And they point to three big studies, all of which were done in sub-Saharan Africa, which again has very different dynamics than we have in the West, right? Hygiene, access to clean water, simply access to medical care in the
Mhm.
first place, right? So comparing developing nations to developed nations is just off the bat. And you've got HIV positive rates in sub-Saharan Africa, 20-25%. So you've got a disease prevalence that's completely different than what you have here. But when you dive into those studies, what you see is a lot of confounding factors. Is the men that are in the groups that get cut, and these are being done by and large on boys and men, not on infants as much there. Um, they get a lot more attention in the study because they're getting a study intervention.
Mhm.
So they get more time with the doctors, they get more
Mhm.
education, they get more access to condoms. They're actually required to abstain from sexual intercourse after the cutting, after the mutilation, because they've just had a surgery they're
Mhm.
recovering from.
Mhm.
So so you've got all these
Confounds.
confounding
Mhm.
issues, right? And we know there's other ways to reduce HIV. I mean, we know, first of all, abstinence works, limiting the number of sexual partners. Um, you know, PrEP, or pre-exposure prophylaxis, is I think highly controversial. We could certainly talk for an entire hour about PrEP and whether that encourages sexual promiscuity
Mhm.
and all kinds of cultural issues around sexual promiscuity. But there are clearly ways to reduce HIV, that are effective. And another way that reduces HIV, we've actually studied HIV transmission again in women who have undergone genital mutilation, and guess what? They have lower rates of HIV transmission.
Mhm.
But again, no one seemingly calls this out
Mhm.
and says, well, why are we mutilating boys but not mutilating girls? If this is in the interest of reducing HIV and
Mhm.
AIDS transmission. And one final thing I'll say on that is there are some specialized cells that occur in multiple parts of the body, including in the foreskin, called the Langerhans cells. And we initially thought there was some initial evidence that showed that those cells were particularly susceptible to HIV transmission. And so the proposed mechanism was that by removing these cells, we're potentially decreasing entry pathways for the HIV virus. But actually, there's some recent literature that's come out that's shown that maybe these cells are actually important in fighting off infection and fighting off viral entry and viral replication. Um, so again, to be doing
Mhm.
something based on three, mind you, large studies, but very hard to extrapolate,
Mhm.
and with a lot of confounding data to take that practice and bring it, a world away.
Mhm.
Again, I think it's wrong in both situations. Please don't misinterpret me. I'm not by any means advocating that this is ethically acceptable in sub-Saharan Africa. But to use these three studies as a basis to argue that this is in any way acceptable in the U.S. or in a developed nation is just atrocious.
Yeah, it sounds like there's a lot of complexity in the studies that you described that was not properly addressed. And sort of this sort of simple answer is what's been landed on, but so many questions are raised. And I think that you did a really good job of educating on the background of that. Fascinating. And I had never even thought about the HIV element. So that was really an interesting explanation. There's This is really an important topic, and I'm really glad that you're doing this work and sharing about this, taking the time to educate people and speak about this from so many different angles. Do you have any resources that you would recommend for people who want to do more reading or understand more about this subject?
Absolutely. I mean, there's so many resources out there. I'll start naming a few off the top of my head. There's a wonderful organization out of New York called Intact America that supports and promotes not cutting boys, and thankfully, well, we actually do have a growing issue with the cutting of girls in this country. But that's a whole separate discussion. But towards genital autonomy, so that's Intact America. Within the Jewish community, there's an organization, Bruhim, that kind of supports Jews that choose not to cut. It's really the only Jewish organization out there. I have mixed feelings about the organization. They don't necessarily advocate against cutting. They're kind of more of a support organization for people who choose not to.
Mhm.
So I'd love to see them be more vocal and more oppositional and adversarial. There's an organization called NOCIRC, and I know that they have a national organization, and I believe they only have one very active state chapter out of Michigan.
Mhm.
But NOCIRC Michigan is very active as well. Um, there's so much out there. I was actually just invited next month to a conference in downtown Los Angeles. It's the second annual. I believe I want to get their name correct. I believe it's called Intact International, but they're a newer organization that's really working on multiple fronts with this. I grew up in California. California almost outlawed this on
Oh,
infants. We had a bill that was passed that then Governor Arnold Schwarzenegger vetoed,
hmm,
mostly due to pressure from the Jewish and Muslim communities. Interesting bedfellow is the enemy of your enemy. But this was this was cries of anti-Semitism, and there was no anti-Semitism at all that went into this bill. And I think a lot of times that you bring this up with Jews is that it gets called out as anti-Semitic,
mhm,
and it's thankfully I have the benefit of being able to speak from the Jewish perspective and say, no, this is an autonomy issue. And if you think this is that important as a religious issue, just like the Anabaptist movement said, baptism is a choice that a person should make and not something that's cast upon them. Again, I'm a Jew. I don't know that I can speak to baptism, but I can, from a completely secular perspective, pouring water on a baby's head as a physician, I can assure you is harmless as long as they don't, inhale that water. So regardless of religious intentions, you're not doing anything that's causing that child harm. And I kind of appreciate the Anabaptist idea that, we're teaching you this. This is how you're growing up. But then at the end of the day, you're making this decision. And,
mhm,
people compare that to something like Rumspringa with the Amish, where they're, allowed to leave and go experience the outside world. And I think those comparisons are problematic because there's a lot of emotional and social pressure that they have to come back. If they don't come back, they're excommunicated from their family. There's huge financial penalties for this. So, I mean, but again, I think that it's the same idea that if this is really important to you from a religious perspective, that's a decision that you as a religious person need to make. That's
mhm.
not a decision that we should be making for defenseless infants.
Yeah. Well, thank you for sharing those resources. If you want to send me any links, I'd be happy to include them also in the video description. And where can people find you if they are interested in seeing more of your work?
Well, thanks so much. I'll be sure to send you those links. I am in the process of launching a new website here. So that'll be drjaredross.com, DRJAREDROSS.com. And I'm most active on X, or I still call it Twitter, at Dr. Jared Ross, Dr. Jared Ross, and also a little bit on LinkedIn and YouTube. Again, the same handle there.
Awesome. I will make sure to put all of your links in the description as well for people to follow up with you. And we have you scheduled to come join us on the Solid Ground live stream in the next couple of weeks. So if people hear anything in this conversation that they want to comment on, or if they have any questions for you, I hope that you guys just leave a comment under the video, and we can get into that and kind of explore some other angles of this and get a little deeper into the topic when we see you then.
I'd love to. I'd really love to, and I welcome all the hard questions and to really talk through that. I'm really looking forward to the live stream.
Yeah, I am too. Thank you so much, Jared. It's been a pleasure speaking with you. And I'm glad we have a follow-up coming up because I'm sure more questions I'll have more thoughts and questions for you as I think about this conversation.
Thank you, Leslie. Thanks for an amazing conversation and bringing up several points that I didn't even think about in this.
Yeah, it raised a lot for me as well. Thank you. And just for viewers, I know we have had a little bit of a video delay throughout the recording, but I think the audio's been good. So hopefully you've been patient with us for during this time, and I'll try to clean it up as well as I can. But I think the audio's been great. So thanks for your patience with our little glitchy, such as the Wi-Fi life, right?
It is, unfortunately.
All right. Thank you, Jared.
Thanks so much, Leslie.